So in the current era, treatment of mantle cell lymphoma is undergoing a paradigm shift. We have seen BTK inhibitors approved in therapy of relapsed refractory mantle cell lymphoma. We also have recently seen results of a trial called Triangle, which demonstrated that patients who were treated with ibrutinib in frontline setting actually had very good outcomes, are comparable essentially with patients who received transplant and intensive chemotherapy induction, if not better. While none of the targeted therapies are approved in frontline therapy of mantle cell lymphoma, there are multiple clinical trials undergoing which already show very good efficacy of these agents in this setting. One of the trials we have reported recently is a combination of Venetoclax, Lenalidomide, and Rituximab. And while there is not a BTK inhibitor in the combination, this is a completely chemotherapy-free approach. So this study enrolled several dozen of patients, again, patients with previously untreated mantle cell lymphoma. It was associated with a very high response rate. Essentially, all patients achieved clinical benefit, and overall response rate was about 90%. Most patients achieved a complete response. The tolerability of the regimen was also very high, with few patients discontinuing either lenalidomide or venetoclax due to cytopenias. But overall, at the time of most recent follow-up, progression-free survival is very good and really compares favorably to chemotherapy type approaches in treatment of de novo mantle cell lymphoma. Still, few patients who had aberrations in TP53 gene did not do as well as the rest of the patients with sort of standard risk mantle cell lymphoma. So these patients, we need to design better approaches for that group of patients specifically. But that is also true with chemotherapy, where chemotherapy is not an effective regimen for patients with aberrant TP53. But in some, venetoclax, lenalidomide, and rituximab is a very effective, safe, novel approach which is chemotherapy-free for treatment of de novo mantle cell lymphoma.